Okay, good morning. We're going to start with skill number 4, which is assisting with the use of a bedpan. You're going to gather your supplies before you actually start the skill. So I'm going to show you one of my methods that I use for gathering supplies. You want to always gather the supplies in the order that you're going to use them. That way you're going to be able to look down and see what you're going to use. The first important thing about the bedpan is we're not going to use the bedside table. Of course, we wouldn't put a bedpan on a bedside table. So we're just going to use a chair. So a chair at the bottom of the bed. And then I'm just going to go over here. And I am going to use the bedside table just to stack things, but I'm not going to actually use it in the skill. So the first thing I'm going to need, of course, is a barrier for the chair. I'm going to need my bedpan. I'm going to need toilet paper and wipes. I'm going to need 2 pairs of gloves. And what I like to do, because this is, of course, COVID time, you will be wearing your gown, gloves, and mask. So it's important that you make sure that you can visualize, because you're going to verbalize putting on gloves and taking off gloves, okay? Again, like I explained earlier. So I've got 2 pairs of gloves in here. I'm going to have a waterproof barrier. I like the large one, but you can use a small one if you'd like. And I'm going to have a privacy towel or blanket just to cover the lower half of the patient, okay? Of course, I've got gloves on already, so I'm going to go ahead and now pick this up, and I'm ready to start my skill. So again, we're going to start our skill with the knock knock. Knock knock, Miss Jones. It's Michelle, your caregiver. I'm just going to place these down. I don't need to do anything with them just now. Washing hands, coming to the bed. Miss Jones, may I raise the bed so I can talk to you? Raising the bed to a comfortable working level. Privacy curtain. Miss Jones, I'm here today to assist you onto the bedpan. Is now a good time? Yes? Okay, great. Miss Jones, do you have any pain right now? No? If you have any pain during this procedure, let me know and I'll stop. Miss Jones is right now in an upright position or a semi-Fowler's position, but she needs to be supine for this. So I'm going to go ahead and put her bed down to a supine position. If the patient is already, or the plastic partner is already in a supine position, just say, patient is already in a supine position, okay? So at this point, the position is secured, and I'm going to lock the bed. Okay, so now that I've done the safety, I'm going to go ahead and cover Miss Jones with a barrier, okay? So for this one, we're going to bring the sheet down, but for COVID purposes, we do not use covers. So I'm just going to place this down at the bottom of her feet so that I know that that's there, that she is covered. We are not exposing her in any way, okay? I'm also going to go ahead and roll up her gown, but she is covered, remember. I have my barrier, and what I see in here is my first pair of gloves. So I'm going to go ahead and put on my gloves before touching the bedpan. Very important. Before touching the bedpan, we're going to go ahead and make sure that we have gloves on. I'm also going to go ahead and put my barrier down on this chair. Okay. Now I can go ahead and place the waterproof barrier here. I'm going to take my supplies and put them down on the chair. I'm also going to take one glove and just place it down here on the chair. I have one glove in the bedpan because this is the glove that I already put on. Okay, so this glove represents the glove that I put on. Okay, I'm going to go ahead and place the bedpan with the wide part here. I always like to say, it's a little bit kind of corny, but it's crack to the back. Okay, and that's how you can remember that. So we're going to go ahead and place this here. I'm just going to cover this here, okay? And now I can ask Miss Jones, can she lift her legs or lift her knees, okay? So she's going to lift her knees. Now, if this were a real patient, because sometimes they do use real partners, you would just, ask the person to lift their knees. Of course, she's plastic, so we'll have to do it for her, okay? So I'm going to go ahead and I'm going to place this here. I have the barrier here ready to go. I'm going to place this just up near her hips. So I'm going to tell Miss Jones on the count of 3, when you hear 3, I want you to lift your hips, okay? So in real life, this patient will be pushing down and lifting her hips, okay? So I'm just going to place it underneath, and I'm going to say 1, 2, 3, and she's going to lift her hips, and I'm just going to place the bedpan underneath, just like this, and just making sure that everything is kind of covered up. Everything is covered, okay? So now that she's on the bedpan, I'm going to go ahead and take off my gloves, wash my hands, very important. We do not want to touch the controls with gloves on. So again, I'm going to raise Miss Jones to a comfortable seated position on the bedpan, okay? So she looks like she's pretty comfortable right about there. Her knees are slightly bent still. And now I'm going to go ahead and tell her about this, okay? Miss Jones, this is toilet paper. I want you to wipe from front to back, okay? And then this is it within reach. And then these are hand wipes. I want you to wipe your hands after you're done wiping from front to back, okay? And as a brownie point or as just an extra, you can tell the proctor that she can put these, or you can tell the patient, you can put these in the bedpan because we are not measuring your urine today, okay? So at that point, I'm gonna go ahead and give her her call light. I'm going to lower the bed, and I'm going to leave the room. She's going to call, I come back. I'm going to again start my mantra. Hi, Miss Jones, it's Michelle. I'm gonna wash my hands. I come in, I wash my hands. The bed is on the low side, so I'm gonna bring the bed up to my working level. I'm going to go ahead now and I'm going to lower the head of the bed. So I'm lowering the head of the bed. I'm asking Miss Jones if she's in any pain sometimes if you want to. Okay, so she's not in any pain. So we're gonna go ahead. I'm just gonna take these and kind of place them in the bedpan because that's what she did. And now is the time I'm going to go ahead and put on my second pair of gloves. Okay, so that's gonna go in the bedpan. So second pair of gloves. I have the call light very near her. So at this point, I'm going to touch the barrier here. So I'm gonna just use one hand. I'm going to take that barrier and I'm gonna wrap it around the bedpan. Now remember, the patient is going to be lifting themselves. I'm not really under here. Okay, so we're gonna again say 1, 2, lift, and she's going to lift. And I'm just going to slide this out, not letting it touch me, and I'm going to fold it just like a present. And we're just gonna slip that down onto the barrier for now. Now I have a clean hand and a dirty hand, right? So with my clean hand, which would be this one, because I touched the bedpan with this one. Basically I touched the barrier, but I touched the bedpan. I'm just gonna go ahead and let her legs down, okay? And I'm going to pull her gown down, and I'm going to go ahead now and remove the privacy blanket while pulling up the sheet, okay? I'm gonna go ahead and take my towel. I'm gonna go ahead and put it on my barrier, rolling it away from me. And now I have my 2 bundles. I'm gonna place this in the designated dirty linen. The patient has the call light near them, okay? I'm going to go ahead and unwrap this. I'm going to place this in the designated trash, okay? It's gonna go in the designated trash. I'm going to go ahead and take this, of course, into the bathroom. I'm going to inspect the contents for abnormalities, or you can just say, it looks normal, okay? I'm going to dump this into the toilet. I'm going to rinse, dump the rinse into the toilet. We never put the materials into the sink. Yeah. So then we're gonna go ahead and wash, rinse, and dry, placing this back in the designated dirty supply area. I'm going to take off my gloves. I'm going to throw those gloves in the trash, wash my hands, come back, making sure that Miss Jones still has her call light. I'm going to ask her if she wants to sit up because that's where she started. She says no, and I'm going to lower the bed, and my skill is complete.